Hello everyone for another PLAB 2 prep with Dr. Al. So in the last video, I talked about when you start a patient on a medication, what do you have to talk about with the patient? What do you have to say? What do you have to, information needed to give the patient? In this station, I'm going to spice things up. Let's say this is a counseling station and the patient is the one who has concern about their medications. Or let's say this is a station where the patient who is being discharged and you have to rationalize the medications. Now, medications like rationalization, when you go through them with the patient, this could be a million different scenarios. No one knows how it's going to come on the PLAB2. Hypothetically speaking, I'm going to think of something and give it to you on the spot. Let's say you're in FY2 in any ward and your patient is being discharged. Your consultant asks you to go talk to the patient, rationalize the medication, something like that, for example. Definitely there could be other scenarios, but just for the sake of this video, let's discuss it like this. So remember that the piece of paper that is hanging outside of the station will have another sheet of it inside. So you can simply, after you say, hello, how are you? I understand you've been admitted in this ward. Do you know why? Let the patient explain whatever it is, explore their understanding about their condition. That's basically what you have to do. You don't want to dive into the history. The patient is going to be discharged. You're not going to waste your time. So I can see from this note here that you've been started on a medication. Let's say which medication? Let's say Ramipril. So I can see that you're started on this medication Ramipril. Do you know what this is? Okay, so this is a medication to control your blood pressure because we've noticed that you have high blood pressure, or let's say the dose has been increased. So I can see that your Ramipril, in this case, you don't have to explain it. The patient's already been on Ramipril. He is or she is aware why they use this medication. We've increased your dose because we think that your blood pressure wasn't well controlled. Then I have to ask at this step, do you have any constant cough by any chance? Do you have any chronic cough? The patient said no. Well, you have to be noticed. You have to take cautious that this medication might cause cough. If do, please contact your GP. Very simple. In these stations, you don't have to follow the structure that we've explained it a million times. Forget about this. Walk with the patient medication by medication. Always ask, do you have any question? Do you have any concern? Do you understand? This medication will have to take with water, side effect. You can ask about the side effect before mentioning the side effect. For example, do you feel dizzy? No. Well, this medication might cause dizziness. Do you feel nausea? Do you vomit? Do you have any diarrhea? No. Well, be careful if you do. It could be a side effect from this medication. You have to contact your GP. Do you see it? So it's basically one by one. Forget the family history, forget the travel, forget the past medical conditions, because you know the medication. So you're on Ramipril, I'll assume it's for your blood pressure, right?